Good morning, viewers. You're welcome to another episode of Monitor Your Health. Hope your weekend has been going on fine, and I hope you're coping well with this COVID situation in the country. Today we have a topic around health system. We know that whatever is going on, even in Nigeria today, regarding our situation around COVID has to do with the health system that we run in our country. We feel it's important for us to explore this and understand what the system is. How will the system help us to build a robust, healthcare structure that we can all benefit from? My name remains Dr. Femi Ogunremi, and I will be your host again today. I have with me Dr. Tanimola Akande, a professor of public health. You're very much welcome, sir.
Thank you very much. Thanks for having me.
It's a real pleasure to have you here. I know the first time we tried it, we had, issues with our system in the country because we had some technical system issue that we could not actually air on that day. We really appreciate your time. We know you're very busy and we are not taking this for granted. Thank you so much for coming.
Thanks so much.
Yeah, please, can you introduce yourself to our audience at home?
Well, I'm Professor Tanimola Akande. I work with the University of Ilorin as a professor of public health and also as a consultant public health physician with the University of Ilorin.
Thank you so much, sir. So we're talking about, the healthcare system or the health system in Nigeria. We'd like you to help us throw light into it. Well, how do we describe, the structural, or even before we get there, what is a health system? Maybe we'll start from there, sir.
The health system has to do with everything that goes into building the health of people across countries, globally, and even locally. And so it does involve healthcare delivery, which most people think is just what health system is. No, it has what we call the 6 building blocks, and that is leadership and governance. We have healthcare financing, human resource for health, which is called the health workforce, service delivery, medical products, vaccines, and technology, as well as health information and technology. These are the 6 building blocks. And in this, we'll find that not just about service delivery, a lot comes into it. What makes people healthy is what comes into the health system. And so it also includes the orthodox, the traditional forms of medicine, and the alternative forms of medicine as well.
Wow. Thank you so much, sir. So in all this, there are so many things involved. It's a kind of a very nitty system whereby you have so many components to it. Now, if we look at Nigeria as a nation, I know your definition encompasses, this is the health system generally. If we look at Nigerian system, how do we describe our health system, sir?
Well, in Nigeria, we have what we often refer to as the tier health system. That is the primary health care, the secondary health care, and the tertiary health care. They fairly align with the structure that we have in the country. The primary care subsystem is mainly within the ambit of the local government at that level, but although we have some high levels that are involved, we also have the secondary health, which is mainly the responsibility of the state governments, and the tertiary health care, which is mainly the responsibility of the federal government. Although we have some private sector also playing some role at the various levels up to the tertiary level.
Right. Thank you so much. So this system that we just described, how well does it function? In terms of the performance and the delivery that we're getting? Because in the end, for any system where we, as an individual, what I want to see is, yes, there's a system, I do not see that system. I see how that actually accrue, or what does it bring to me. So in terms of the performance and the delivery, how do we describe this, sir?
The ultimate is to make this system such that people have easy access to quality healthcare, and therefore, if they're ill, they get well and they live long. And WHO has rated various countries in terms of the performance of the health. Unfortunately, Nigeria performed very, very low. It's scored 187 position out of 191 countries. That's terrible. That's probably we are better than just about 4 countries with that kind of performance rating. We also know ourselves that we have a very weak health system. Access to quality healthcare in Nigeria is very low. And even indices that we have suggest that the health system is not performing well. You have a very high maternal mortality ratio, a very high infant mortality rate, as well as under 5 mortality, and many other rates too are so abysmal. And then they're encouraging for now. If you want to see the performance, for example, in the context of African countries, we are not even, although we say we're the giant of Africa, but when it comes to health care delivery, we're not really the giant of Africa. By the 2018 Health Quality Access Index, 97th out of 107 position. While the country Egypt, 64th position. So Egypt, Kenya, which scored 12th, and South Africa 119. All this, rated better than Nigeria. And also we look at ultimately what point is if you have good health, you live long. The life expectancy at birth in Nigeria is about 55. Some people quote about 60, but I don't think it's up to 60. What is most known is about the 55. But with some other countries like Egypt, it's 70 years life expectancy at birth. And the average for Africa is 62.5. And so Nigeria is far below even the average for Africa. So with this, you can see that our health system is very weak and poor.
That's quite it's an open secret. I don't think it's something that most of us Nigerians are not aware of. And when I look at this situation where even our leaders, when people are unwell, you don't even trust the system that you're building yourself. Yeah. And it leads to a situation where if you're a top-ranked person in the country and you're rich enough, you have headache, you don't want a doctor not a doctor, the system in Nigeria to take care of you. The next thing is you're jumping on the plane and you're going out of the country. It is actually pathetic and very, very sad. Now, with the the comparison you just gave, when we look at even the countries that we think we're a monster over them, and because we're the big and giant of Africa, they are performing quite well than what we are delivering. But what can we do, in all honesty, if we look deep down into the roots of the system? Because, as a medical doctor, you were my teacher in medical school. You taught me this health system, I remember. And then, since I was in the medical school till I'm here now, doing what I can do, I still look at the same system that we've been running. Nothing seems to have really changed. If anything, I had the opportunity to do my postgraduate degrees in the UK and all that. When I come back to Nigeria and I still see the same situation, nothing is changing. When we say that we're not, my own understanding is if there's some situations where things are not working, we should be looking at a way for a change. Why is it so rigid that our system cannot change for the better? I don't get it. Is there a solution? Are we ever going to get out of this cul-de-sac? Ever?
let's be optimistic that we will someday, but it's disappointing that over the years, the various health indices have not changed much. There is still the same stories of woes. And a lot needs to be done to correct the ills that we have in the system. In the area of leadership and governance, for example, as a building block, we need our leaders to prioritize health. They don't see it as a priority. For any government, what the health of its citizens should be is major concern. Some will lip service prioritization of health. It's lip service if you don't give it enough of the resources required for it. So our leaders should prioritize health and make the provisions that are necessary. And also, they should be healthable at all the levels, not just at the national level or state or even local, at the institutional levels too. All that is budgeted for them or allocated to them, how do they spend it? Do they spend it appropriately? Do they spend it efficiently? And so these are things that we should do. And then importantly, we must fund healthcare appropriately. In fact, for what is used in funding healthcare, is some animals are even better funded in terms of their health in developed world than the human beings in Nigeria, unfortunately. What is the budget of the whole country on health is what a single city will spend in developed world. So we must be able to commit enough resources to it. As it stands today, is the individual that bears his burden when it comes to healthcare. Out of the total health expenditure, about 70% is from the out of pocket. That's what people pay as they access care. And what government contributes is therefore low. What other developed countries will do is to also have what we call the health insurance scheme to be able to take care of some bits of this so that you be your neighbor's keeper. Health insurance coverage in Nigeria is terribly low. So we have to scale up. By now, we still have about less than 5% of Nigerians covered for health insurance. If we don't scale up, we still continue to have all these woes. And then you talk about the human resource. That's a very big challenge in Nigeria. The brain drain, you won't blame any doctor who wants to move to where things work. So we have a lot, not just doctors, even some other cadres of health workers are also having the brain drain. That is, we are far short of the doctor population ratio that WHO prescribes, far short of it. So until we address all these weaknesses, we won't be doing much. And we must, as a nation, be committed to improving the health of our citizens.
Thank you so much, sir. And I know that this topic is big when we look at the amounts of problems that we have in health system, well, in healthcare delivery in Nigeria. Sometimes I sit down and start thinking, in all honesty, are there, a lot of time we've had discussions, a lot of time we've had meetings, and I try to be very careful when I say things on this program because, again, there are a lot of Nigerians who want situations to change, but there are as many as those ones that want situations to change that do not want them to change as well. I then start thinking, if we look at a proactive way, measures, things that we can, quantify in terms of what we do to have a kind of a sustainable quality, that's like you put a sustainable quality healthcare system in the country. Are there things that we can table down? I know you mentioned the governance, you mentioned financing, you mentioned all these things, and they're real, they're facts. But we've said this for the past 40 years, 50 years, and nothing is changed. And then we can continue to say it to tomorrow. maybe nothing will change. That's why, as much as if I'm not optimistic, I won't be in Nigeria as I stand here. I'm really optimistic about the fact that Nigerian health system will change. On a personal note, and I know so many of us are doing their own bit, we're trying to do it. Are there things we can probably give to our government if they will have hearing, if they will ever hear and listen, because that's a big thing. A lot of this people who take decisions, who are meant to make things happen, to me, it's just like they're not even hearing. It's like there's a wall that's blocking, their hearing. I'm sorry to say it, I sound rude, but it's a fact. You understand? So now, are there things we can do to ram this into people's head, to let them know proactively? These are things that we can do to change our health system, to strengthen our health system in this country. Because it's sad. A lot of people are dying. People are dying. And it's very, very obvious to everybody now. COVID has exposed our weakness, our deficiency. And if we don't get it right now, we will never, ever, ever get it right again. I don't think there'll be anything else other than COVID that can make us, I've lost loads of friends. I've been hit myself. I have so many friends who are still suffering the situation on ground because of this same system we're talking about. Are there things that you can tell us today, sir, in this country? Well, things that we can do proactively to improve the system?
Like I've said earlier, see, leadership is key. It drives so many things. In fact, it drives a lot of other things within the building blocks. We must be committed to the right leadership. How do the leaders emerge? Who becomes what? If you don't get the right people there who are keenly interested in improving the health situation, things will not change. And when you then get the right people there who have the vision, who have the competence of what to do, then the funds available can then be spent appropriately, and they prioritize the right things. Of recent, I really overjoyed when I saw and read the story about Federal Medical Center in Lagos. This one, Ebute Metta. Yeah, that's about leadership. What has changed? And you can see the place working efficiently. If we can replicate the same thing all over the country at various levels, not just at tertiary level, then things will change. It shouldn't be the business as usual. You can't be doing things the same way and expect a different result. We are still doing these things the same way and expecting a different result. So we must be conscious of the fact that we need to improve. And the leaders particularly should take the lead in this. Why will somebody, this medical tourism, why will you, because you want to treat just a fracture, you run out because you don't trust the health system? And that's an enormous loss to our economy. You can imagine if all the money that goes into medical tourism are plowed down into the Nigerian health system, then it would be so fantastic. So I think it's about, well, having the correct leadership, the political will, funding health appropriately. Nigeria is a signatory to the Abuja Declaration that says at least 15% of its budget will go to the health sector. We've never achieved that, never, far from it. So until we do the needful, although some bits of policies are in place, we are not short of policies in Nigeria. Implementing these policies are the challenges we have. That we need our leaders who can influence and then drive us to do the needful. Everybody should be concerned. It's not just our leaders alone. Go to the health facilities and see the attitude of health workers. Until we change all this, then we will not be ready to move. Some equipments will be brought in so to say new. How long do they last? That takes the question of sustainability that you're talking about. You bring an equipment into the hospital, you don't have any contract with those who are supplying it to maintain it, and then within a year, the thing breaks down. So we can't continue this way. and expect that things will function well.
Thank you so much, sir. So then that would then take me into obviously maybe I should have asked these questions before we got into this. I know there are challenges. Obviously, when you were trying to explain now, I realized you were looking at the challenges and you were addressing them. There are challenges in the system itself. Obviously, are there obvious challenges that we can table out, and maybe we can then from those challenges and see whether we can push in some suggestion and advice for the policymakers.
Yeah, I've mentioned the challenge of poor leadership. For that, the citizens have to hold them accountable. They choose to be there, and so they must be doing the right thing. On their own, they may not want to be accountable, but the citizens have the role to make them accountable. And they promise us a lot when they want to get into such positions. And then we have to hold them accountable whether they are delivering based on their promises. Then I mentioned the poor healthcare funding in the country. We need to address that. We need to scale up very fast the insurance scheme. Many are getting into catastrophic expenditure because of accessing healthcare. We need to avoid this, and quite a number of unnecessary deaths too, because certain equipments are not in place. We need to get things there. We have the best of brains in Nigeria. That's why you find that when they leave the shores of Nigeria, they perform excellently well. But if you're in a system where you don't have what it takes to deliver, then it will look like you're not good. So until the system provides what you require to deliver, the number of doctors that are in the country are getting low by the day. The way the brain drain Nigeria now is terrific, and we need to do something to prevent this from being at the rate at which it is now. We have a ratio of 4 doctors to 10,000 people. They get tired easily. Some of them get beaten up in the hospital because they think they are not serious enough. This guy has been working for 2-3 days, probably no break. I mean, he's a human being. But if you have enough of such people, doctors, nurses, and so on, then we'll be able to address them. And it's not that we are not producing these people. We are. It's just that some of them go by brain drain. Some are even not employed. In some states in Nigeria, they've not employed health workers for the past 3 years. And you expect them to do magic. They can't. They can't do any magic. So until we've addressed some of this, and the issue of even drugs as well, we will not go anywhere. You get to most of the health facilities, is a stock out of drugs. And even those that are operating the drug revolving scheme, I don't know how you can be operating a drug revolving scheme and yet have stock out. I mean, it's not acceptable. When the pharmacy outside, we hardly have stock out. Why will the big ones be having stock out? So the attitude must change. We must be interested in the health of the ordinary Nigerian for things to work out.
Thank you, sir. Now, there's, as part of the system, you talked about the professionals involved, doctors, nurses, for all this group of people. There's this arm that I think, people will talk about, we're Africans, and, our roots is based to the traditional way of, taking care of our people. And it worked well for us until, the British came in, and then things start changing, and then we have to imbibe, the orthodox medicine and all that business. And there's still issue around, why can't we be Tredo? Why can't we, where is the position for traditional medicine in our system? Is it something that can strengthen our system, or is it something that we need to be careful with?
Well, globally, traditional medicine have their roles to play. Most of drugs have their origin from herbs, processed well, gone through scientific measures to show that their efficacy is there, and then they are safe for people. So the traditional medicine has a role. So also in Nigeria. But unfortunately in Nigeria, it's not a well-regulated aspect of the health system. Anybody can just wake up and become a traditional healer. Whether you receive tutelage or not is about whether your mouth is sweet enough to attract clients. And they use all sorts of things that for most of us, we can't understand how one single drug will cure 12 different kinds of ailments. And we have a government that they listen to this on the radio, and yet we don't have the appropriate agency to regulate until they are regulated and then also put through training. And we can now scientifically see what they're doing, then we'll still remain the way we are. Certainly they have their roles and they should be integrated into their system. But the way we are going about it now, I think is too dangerous. We have a lot of them, of people get into them because they don't have money, and then that's a very easy route to get to get treated. And at the end of the day, they have complications, and then they now know that the orthodox place is there, and that is almost at the point of death. This shouldn't be. The traditional herbs should be such that they are properly packaged, have correct doses, scientifically proven to have efficacy and safe. If that goes on well, then they have a lot of role to play, even in Nigeria.
Thank you so much. So, as an individual, obviously, we talked about the expectation. Well, what I expect as a Nigerian, which I think is the responsibility of the government to make available, is that basic health needs that is quality that I as an individual in the country or as a Nigerian I have access to. That's not the situation now. What do you advise me as an individual or us as individual? What do you advise us to do? For us to fit in and get the best out of the chaos system that we have at the moment.
Well, you see, it's unfortunate that in Nigeria, each of us just as go to the health facility, have our challenges, make a little noise, go back home, and that rests the case. And then you will go again, another illness, the repeated thing. But nobody comes out loud to say, look, we must change this. This is what my experience is. Form groups. Luckily, we have the civil society organizations. But how much are they doing in terms of, we don't have enough of them. Most of them are concentrated in Abuja. You need them at all levels, such that they can raise voices and make advocacy to government so that all things that need to be done is done. We have various religious groups, traditional setting groups. All this should be the issue of health should be a burning agenda for all, so that we can we can let people know the challenges we are facing and even suggest what solutions that can be preferred to it. Sometimes some of our leaders they don't even see the reality on ground. And unfortunately, Nigeria is until you do a luta, it's not good enough before people begin to respond. But sometimes you will make a lot of communications and then say this is the situation. But who is listening? Our leaders must be made to listen and do the needful.
Thank you so much, sir. So somebody is asking a question here, but I think it's a question actually. It says, sir, can you please talk more about the people holding government accountable for their welfare? How can this be made possible? Okay, So I think it's more of a comment and a bit of a questioning. I'll leave it to you to answer that, sir, or to address that.
It's possible. You know, we have legislators that are representing us at various levels. They are supposed to have community meetings. These are the fora they can use to know what the people are going through. And it's these same people that will now begin to legislate and begin to also see how government is performing by doing their oversight functions. If they do this well, if all this process goes through well, and your representative knows what you're going through, then they will raise their voice and then do the needful, make government, the executive arm of government, to do the needful in terms of service delivery. And then beyond just this system, like I mentioned, we have the civil society organizations. What is the budget to the State Ministry of Health last year? How much of it was really disbursed to them? How efficiently did they spend this money? The CSO should be interested, even at institutional levels, that this teaching hospital, this is the amount of money given to you for so purpose. How did you use it well? So until we hold everybody accountable, and who will hold them accountable is we, the ordinary people, by coming together and then maybe as a CSOs, NGOs, to see that the right thing is done. If the money allocated is even small, but people can see how well you've spent that money that is allocated to you, then it will make sense. And then they will now know that the problem is about inadequate funds. But even with the funds given to you, how well have you efficiently spent this money in healthcare delivery?
Thank you so much, sir. We'll be getting to the end of the program, but before we get in there, I want us to look at, you know, out of pocket, payments for healthcare delivery is a major issue. I don't think, I know that it might be theoretical, whatever we're saying in this area, because of the level of poverty in the country. But the healthcare system that we run now, of course, is out of pocket. I've had situations where, in the environment where I am, there have been an incident, and then we had to take somebody from somewhere to the hospital. There's no ambulance. We have to rush them in the private system and get them to the hospital. We get to the hospital. First thing is money. Okay, are there things that we can do? Yeah, I know there's insurance that is coming up now. How can we build a system now that will support people, being taken care of, but it doesn't have to be out of pocket. I don't know.
Well, we do know that of the various options in financing healthcare, the least efficient is out of pocket. And like you have mentioned, more so in Africa, where people are poor. And in fact, the poor have a heavier load or burden of disease, and yet you want them to pay to access care. So until we change such that out of pocket won't be so high, like the 70%, having the health insurance scheme covering a wider proportion of our population, that is when we can begin to see a difference. If you are on health insurance, you don't need lots of money in your pocket to access care. And so we need to speed this up. Health insurance is about cross-subsidy. The poor are being subsidized by the rich, who are also in the scheme. The healthy is cross-subsidizing for the ill. So not all of us will be ill, but everybody is contributing into this pool of money. And so if we do this well, then the issue of out-of-pocket will get lower. You can't totally say it will not happen at all, but it will be so much low that for basic health care, you are able to access care.
Yeah. So, but what practical measures can we take to make this happen?
Well, we have the National Health Insurance Scheme. It's been there since 2005. The speed is so slow, but it's good that now it's been decentralized. States are now having their various schemes and agencies. the states too should fast track coverage. And where possible, although this segment in health insurance is not good, if you have too many segments, the bigger the pool, the better. But now that at the state level, let them enroll people and have them have targets of saying, okay, at least I want to get about 70% of my citizens in that state enrolled. If we're able to do that, then there'll be a considerable difference. So it's now not about just the NHIS, because now at least they've allowed states to also do something. So states should be very proactive. Almost all states have had their agency now, almost all. So no, it's not about just having appointing people. Do the needful, enroll people, make sure that the health insurance scheme itself takes off.
Thank you so much, Prof. It's been, a good session with you, and thank you so much for your time. On a final note, what are your final words for the country, for the government, individuals, and then we'll come to the end of today's program.
Well, the health system in Nigeria is very weak. It's been tested with COVID now, the current issue, and it has. We just hope that the dimension of COVID will not go beyond this. Then you will see how flatly the health system will fall. So what we need to do is to revitalize the system and do it along from our leaders to the last person. Everybody has a role to play. Each person should play, or each group should play its own role. Government should do what it is supposed to do. The individuals, the health workers, all of them should play their own role, such that we can now begin to tell some other of a reduced and better health indices.
Thank you so much, sir. So it's been a pleasure having you here this morning. And to the viewers at home, thank you so much for always being there. This program cannot exist without you. We really appreciate you. I hope we've learned from the topics today. We know that might sound a bit dry, and maybe we do not know this is not malaria, this is not typhoid. But the reason why we brought this in is the system that we run is what determines what we get, like you can see. So it's all our responsibility to put our own bits into it to make the system work, because it's like something that is nodal. You have different nodes. All the nodes are links, they're interwoven. You have malaria, why did you have the malaria? And you're going to be treated. How are you going to be treated? So all these things are knitted together, and that's where we as individuals were in the center of it. So we hope that you have picked one thing or the other. We hope that you would contribute your own quota to make the system in Nigeria a robust one. It is doable. This country has potentials. We do have it. Let us come together. Let us aggregate. Let us talk about it. Let us get our local leaders to know the impacts that this needs to, that this has on our own life, and then they can help us to push to the people that need to hear about it, and then redistribute the system in a way that it becomes more strengthened and efficient for us all. Thank you so much, and we hope that you have the best of the weekend, and we look forward to meeting you again next week, when we're going to come up with another, educative topic that we all benefit from. Have a nice weekend and stay blessed. Stay safe as well. Bye-bye.